Good morning, friends. This is Dr. Nayana Patel from Akanksha Hospital and Research Institute, Anand, Gujarat. In this period of lockdown, we are going to start with a series of some informative health talks which all of us need to know and can help many. So today's topic is the first one, is the basic information on IVF. Infertility is on a rise because of various reasons like junk food, late marriages, lifestyle changes, no exercise, and career-oriented females who would delay a pregnancy. All this leads to a rise in infertility all over the world, male as well as female. And IVF is a solution to many cases of infertility, I would say most of the cases. It was considered as a last option, but now it can be considered as a first option for many couples. Mainly done for couples where the husband has a very low sperm count, where there is unexplained infertility 5 years and they are not able to conceive in spite of everything being normal. Cases of tubal blockage, when the fallopian tubes where the egg and the sperm meet and fertilize is blocked. There are cases where the eggs get exhausted and donor egg is to be taken. Then there are cases for endometriosis where the ovarian reserve is going down very low, and patients with lot of adhesions inside who will need an IVF to have a baby. There are so many misconceptions and myths regarding IVF. First of all, people think that it's a very expensive treatment. I would say that yes, there is a cost attached to it, but it's not an expensive treatment. We always tell our couples to collect a certain amount of money when we know that they definitely need IVF because the sperm is not of very good quality or the tubes are not functioning properly. It's better to wait, collect money for 6 months and start. Second myth is that everybody gets a negative result. Yes, I agree that there is not 100% positive to all IVF cycle, but I would also like to remind you that any couple who keeps trying for a number of times definitely gets a result. Maybe the treatment options can change, and on an average I have seen the couples who pursue it properly, definitely 90% would get a positive result within 3 cycles. Yes, you need patience, you need perseverance. The other myth is that people tell that, why are you trying IVF? There are other options available. Yes, each couple is a different story. Some couples even at 35 years would get a result with natural conception, and certain couple at 25 years also of age would need an IVF. So don't compare your cycle with other couples. Your case is a different. So now it's an individualized IVF treatment for all. Regarding the injections, the females, yes, they have to undergo a lot because normally in IVF what happens, in a natural cycle a female produces 1 egg. But in IVF we need a good cohort of 8, 10, 12, even 15 eggs. So to produce those 15 eggs from day 1 of her menstrual period, we start giving her injections at a regular fixed time. It's 1 shot daily. Examine the female on the 6th day, 8th day, 10th day. By the time she reaches 6th day, 1 more injection of antagonist is added, and by 10th day all her injections get over, and the 12th day we retrieve the eggs vaginally. Just a short sedation or mild low anesthesia, short anesthesia is given, an injection in the hand. These eggs are then retrieved, fertilized with the husband's semen, and the embryos are created. A fresh transfer is when we transfer in the same cycle on the 3rd day, a day 3 embryo or day 5 blastocyst. Supposing a female gives 12 eggs, it's not necessary that all her 12 eggs will become embryo. Some may fertilize, say 60-70%. So by the time it reaches day 3 of fertilization, we have removed egg today, but after 3 days when we check, it's called day 3. That time, probably out of 12, only you are seeing 7 live day 3 embryos. Day 5 is a blastocyst, which a better embryo and a higher success rate. That time maybe out of those 7, only 4 can reach a blastocyst. So these blastocysts are transferred, or day 3 is transferred in the same cycle, or they are frozen, and then after the next period, again the female's uterus is prepared either in a natural cycle or by giving her hormonal tablets to prepare her lining. Again, each case is individual. Certain females who ovulate naturally may benefit with a natural cycle transfer. Some females who do not ovulate naturally will need hormone therapy to prepare their endometrial bed, and then we do the transfer. Younger the age, the success is higher. So a couple with a female of just 25 years of age undergoing IVF because of tubal block or a severe male infertility may have a success of 50-55%, per cycle 60%. But a female at 40 years of age with everything good, but still her success rate drops to 20% per cycle. This is because the success of IVF mainly depends on the age of the egg. So younger you are, better result. In Indian scenario, after 32 years, the quantity of the eggs go down, and after 35, quality. So the age of the egg is a big deciding factor. So if you are planning a cycle, definitely plan it at a younger age rather than waiting for a longer duration. The other is prepare your body holistically. Take vitamins, start an exercise, green vegetables, almonds, walnuts, dry fruits, any form of exercise, whether it's yoga, whether it is aerobics, walk, you have to do any form of exercise. Improve your lifestyle pattern and go to bed at a regular time, get a better regular time. All this put together with a positive attitude, my dear friends, is definitely going to show you the light at the end of the tunnel, and I'm sure this IVF treatment will help all the couples all over the world see their baby. Egg donation is needed when the female is of advanced age or at a younger age her eggs get exhausted, like she's affected with tuberculosis of the ovaries, or she has a bad chocolate cyst and most of the ovary is not functioning now. Egg donation has a very high success rate, 60-70%, and in 2 cycles 90%. There are females who will need a laparoscopic surgery prior to IVF to improve their chances of success. Sperm donation when the husband has no sperms, but with no sperms also there is a category of male which can produce sperms, but they are not ejaculated, so we can take it from testes. But even after that and micro TC there are no sperms, sperm donation. And finally, when men and women both has a problem, embryo donation. Like an adoption, it is a pre-implantation adoption, and this gives a very high 75% success rate per cycle. So I think I have covered the basic part of IVF. Now I have started getting a lot of questions, and you can still put on your questions. I have this first female from Patna. She says that she had 2 miscarriages at 21 weeks and 19 weeks, and now she needs a surrogate. I will advise you that what is surrogacy? When the female's uterus is not healthy and cannot carry a baby, either because it's malformed or it has got recurrent miscarriages at 20 weeks or there is adenomyosis, then she will need a surrogate to carry a baby. Or a female is not physically capable with cardiac or renal problem, she will need surrogate. Or 1 in 4,000 females born without uterus will need a surrogate. So surrogacy is a treatment when the embryo of the couple is created with their egg and sperm, or sometimes one of the egg or sperm baby donor. This embryo is then implanted in the uterus of the host mother, that is the surrogate, and once the baby is born, it's handed over to couple. I would like to inform this patient from Patna, Bihar, that yes, surrogacy is an expensive procedure, around 15 to 16 lakh of expense is there. But for her problem, I can suggest a nice option, and that is interval laparoscopic cervical circlage. After getting pregnant, you can put a transvaginal circlage, but this is before getting pregnant. We can help you with a laparoscopic surgery, and a tape is applied around your cervical internal os opening, and it will hold the cervix very tight. and after that you can try conceiving even naturally IUI IVF. The only thing is, once you conceive, the mode of delivery will be a cesarean section. Once you conceive, I can help you with this procedure. By 5th month, you will be on complete bed rest, and we have got the protocol in place where we put you on a lot of progesterone, we put on drugs which will stop your uterine contractions, and there are patients and number of studies which has shown that with this interval laparoscopic cerclage, you yourself can carry your baby and deliver around 30 to 33 weeks. So surrogacy is definitely a good option, but even this second option of laparoscopic cervical cerclage is very, very helpful, and it's going to be very, very cost effective to you. And the best part is you will enjoy the motherhood and you will carry your own child. There is another one question, the cost of surrogacy. And the second question, the same patient has asked that how many days do I need to stay in hospital after vaginoplasty procedure? There are patients, females who are born without uterus and they do not have a vagina also. So we create an artificial vagina so that their sexual life is normal, but she will definitely need a surrogacy. So surrogacy cost will be around 15 to 16 lakhs, everything put together, the IVF, the delivery, the payment to the surrogates, the compensation I would say to the surrogates. But the vaginoplasty procedures are done in 2 to 3 different ways. One is Makindo procedure, Davidoff procedure. So what we prefer is whatever suits to the female. One is simple laparoscopic procedure when we pull the peritoneum down. In that case, in 3 days you will be discharged. One is a little difficult procedure where we put an applicator on the abdomen and laparoscopically, and then every day we tighten it. So there a 1 week stay would be required. But we can counsel you regarding both the procedure when you can make a one-to-one video call to us, and then we can decide the surgery for you and you can come over and get the surgery done. But the results of vaginoplasty surgeries are very good, and normally we advise 6 months before you are getting married or we want to start your sexual life. Sometimes the vagina is so nicely made, though it's not good for sexual intercourse, but at least with the dilators also plain we can develop the length. So once we check, you will be able to guide you further, but there are various options available. This another question is from New Zealand, and she is looking for surrogacy again. So if you are from New Zealand, I'll ask that you should have an Indian passport to get the surrogacy done in India. And for that, what we do is we start your IVF cycle, we create your embryos, freeze the embryos, and then we introduce you to the surrogate. Once the contracts are signed and put into place with all the documents that we need from you and all the documents we need from the surrogate and all the blood workup from both of you, these frozen embryos then are decided and transferred in the womb of the surrogate. You can also email me and we can give you the detailed procedure and the costing. There is one more regarding, this is from London, and she is saying that she has an 8-year-old baby, but now she is not ovulating and her scans are not going good results. So how do I go about doing my IVF? So IVF, as I said, it is based on the age of the egg. Now this female, this patient might not be having proper eggs. So we need to know her age, and we are doing a lot of treatment to rejuvenate the ovary and the eggs. We do one is called as bone marrow derived stem cells, or it's a concentrate, not a stem cell, and the PRP, platelet rich plasma. This is taken from the female's own blood, and then we inject it either laparoscopically or transvaginally in the ovaries, and that will boost up the ovaries, and there will be an improvement in the quality and the quantity of the eggs. Not quantity too much, but quality yes, and there are a lot of successes all over the world. The other is ovarian tissue activation, where we do a laparoscopic, take out a part of ovary, we treat it, we put it back. This detailed explanation will be given to you day after tomorrow by Dr. Nayana Patel, who is going to be again on this live talk on how to rejuvenate your ovaries. But the last option, if you are totally not ovulating and your AMH, that is the anti-Mullerian hormone, and scan. How do we know that how good are your ovaries? One, you are ovulating naturally and getting normal cycles. 2, we do a scan on day 2 or 3 of your cycle and see the ovaries and number of follicles, that is the basal antral count. And 3, we do a blood test known as anti-Mullerian hormone, which will show us the ovarian reserve. So if these 3 reports you can send me, I can judge what is your reserve and tell you exactly what treatment to be done. As you are in London, you send me your email and phone number, we can have a video conferencing at a convenient time for UK time zone. This is another patient from Vadodara. She is saying that her original beta HCG was high, then it came down 673 to 300, and now the doctor is saying they cannot see a baby. Yes, beta HCG is an indicator of the pregnancy, whether it's surviving normally or not. It depends on a lot of factors, whether it was a natural conception, IUI, IVF, and how do we interpret it. On an average, your beta HCG level every 48 hours should nearly double. If it starts falling, then it's not a good pregnancy. It could be a case of missed abortion. It could be a case of ectopic pregnancy. So you should be also careful that if there is a pain in the abdomen or abnormal bleeding or you feel giddiness, immediately get a scan done to see that whether the baby is growing inside the uterus or outside the uterus. So when the beta HCG is doubling regularly at 2 days, that's a healthy pregnancy and will progress normally. But if it's falling down, not doubling, then chances of missed abortion or an ectopic pregnancy are very high. I hope I have answered your question. If not, you are free to call again and do a video conferencing with us. Send your phone number and email. If there is one more question, where they have written very nicely that if the female is diabetic and overweight, what is the IVF success rate? How much of rest is needed after IVF? Yes, whenever there is a comorbidity, the success of IVF gets little compromised, with overweight also and with diabetes also. So normally if you are young, we advise try to reduce your weight. We don't want a drastic reduction. Say if you are 100, we don't want you to go to 60. It's just 7 to 10% of your original weight. So if you are 100, try to come down to 93 to 3 months. Diabetes also, HbA1c is very important. That is the indicator of 3 months of control of your IVF, of your diabetes, sorry. So if that HbA1c is less than 7, we are happy to start. But if that HbA1c is around 10, 11, I don't want to start the treatment because the eggs and the embryos will not be of a healthy quality. So whether the husband has diabetes or the wife, husband is overweight, wife, if implies to both, reduce your weight by 7 to 10% of your original weight, take multivitamins, coenzymes, and get your HbA1c within 7. After that, we start your treatment, and then the treatment is like any other normal patient. You will give good quality egg or good quality sperm and embryo, and then the chances of success are good. All throughout the implantation period, transferring embryo and pregnancy, we need the diabetes under very good control for a healthy baby. How much of rest is needed? I would say that rest is not a must. Normally after the embryo transfer, we advise 3 to 4 hours in the hospital, then the female can go back. But sometimes the females are themselves very concerned because in India they pay out of their pocket and they feel that I've spent so much of money, and there is so much of family support in India that females and the family would want her to rest and get the best outcome. The embryo gets implanted, but once 3 to 4 hours it is inside the uterus, you can move about, do your routine. In abroad, they just go for an embryo transfer in a lunch break and go back to work. But in India, we suggest that first 3 to 4 days, keep your physical activity to bare minimum. If you have to travel abroad or travel out of city, also 3 to 4 days don't. But after that, you can start your normal activities, what you are doing. No vigorous exercises. Take your healthy diet, and routine work should be good enough, but not over exercise. So this is regarding the rest after IVF. But I've seen my Indian patients would want to rest all 15 days, and if it is positive, they want to rest till they deliver. But it's not a must for IVF that all patients need to rest all throughout. There are patients who work from home or do a desk job. But if you have to commute far in a different village, and if you have to travel a lot, I would say that that should be restricted. Duration of marriage, another question. Yes, this is good. Duration of marriage is 5 years, trying to conceive but cannot. What is the reason? Yes. If we consider a normal couple who is not using any contraception, having a normal sexual life, say 3 times in a week, this couple, if they are normal men and women both, 90% of them will conceive in 1 year. Out of the remaining 10%, 80% will conceive in the second year. But if you fail to conceive in 5 years, in spite of not using any contraception and having a normal sexual life, then there is definitely a problem which we need to identify. It could be the egg, you might not be ovulating. It could be that your tubes might have a problem, or you have had a surgery like appendectomy and the position of the tube and ovary is changed, or the husband's sperm may not be up to normal standards. So these patients definitely need an investigation and to find out. Supposing everything turns out to be normal, the ovulation is good, tubes are patent, which we know by an X-ray HSG or we know by laparoscopic tubal test, and the sperm count is normal, then we have to go deeper inside and start the treatment procedure of giving ovulation inducing drugs, planning an intrauterine insemination, taking the sperm of the husband and the time you ovulate. The female should remember that if their cycles are normal 28 days, they ovulate 14 days before. This egg that they release in their body is going to survive only for 36 hours. And the sperm that enters her body is going to survive for 48 hours only. So if in that 3 to 4 days they never had an intercourse, they will not conceive even if they try all the other days. So this is very important. And then we try to do a timed intercourse with ovulation study, IUI, and if everything fails, I think 5 years is a long duration. Age also matters. For a female of 25 years, 5 years, definitely there is a problem, because younger the age, you conceive faster each cycle naturally also. So that is the time when at least you should think of an IVF. An advanced age female, 34, 35, late marriage, don't wait for 5 years for your IVF. Your biological clock is ticking. So start the treatment within 1 year also, because you want the best eggs and the best sperms to give a best embryo and a healthy baby. So these are the reasons in this female we should try to find out. Now this is another question from a female, that she has low seeds. I assume that she means she has low quality and quantity of eggs. And is there any way out of IVF? Yes. As I explained, that to improve the ovarian reserve, these 2 procedures, ovarian rejuvenation or ovarian tissue activation, also we can start supplementing with DHEA tablets and coenzymes for 3 months. Aerobic exercise, any blood flow that increases to the ovary also helps. Start doing all this. And acupuncture also helps. After that, what we do is, either we do a routine IVF and see conventional IVF and collect your number of eggs with injections. And the second option is very good, where what we called is mild IVF, minimal stimulation IVF, back to back in each cycle, and try to accumulate your embryos which have vitrified, and then these vitrified embryos can be collected and later on transferred in you. So this treatment, don't think this is done abroad, this is done in India also. And I have a patient from our own town who is wanting her own egg. She's 32. We did the first cycle, only 2 embryos. Now we have started collecting, but what we do from day 2, we don't start her injections. We just give her tablets. And then on the 8th and the 9th day, 1 or 2 shots of injections are given HMG. Initially we give either Clomid, mostly we prefer Clomid. 8th, 9th day we give low dose HMG, and the 10th day we give the trigger and take out the eggs. So it's just 2 or 3 injections, egg retrieval procedure. Again 1 cycle rest, take DHEA, next cycle again start this. But patients who come from abroad and have a shorter time, what we do is a duo step. We start stimulation from day 2, collect our eggs, 4 days later of retrieval of eggs, here we give the trigger of agonist only. Again we start a second stim and collect the eggs. So in these females, collection of eggs and embryos is very important, and once we get, I would say, at least 4 good blastocysts, but there are females who are happy with 2 also. We then do the embryo transfer, and this can give a better result. So you don't need 10 conventional IVFs, you need 3 to 4 mild stimulation IVF to collect your good quality embryos and still have a baby of your own with IVF. There is one more question on cost of IVF. Yes, this is a burning issue in India. Now there are some Bajaj Alliance etc. who have started EMI with us, but the cost of IVF, what are the cost factors? One is the injections for IVF, second is the retrieval procedure, the needle, the disposable, the embryo transfer, the catheter, the laboratory, managing an IVF lab. It is the heart of an IVF, where 2 or 3 cycles randomly in batch are done is no good. Regular IVF cycles are being done. Regular monitoring of the quality of the lab. What is the air quality, a different AHU, what is the pH, what is the carbon dioxide, oxygen saturation levels all inside, what is the humidity. These parameters are monitored every day. That adds to the cost. Then there is the media and the disposables like petri dish, the pipettes, the ICSI needle, the holding needle. All this makes it a very costly procedure. But yes, we have devised packages which can be based on the cost of the injections. We don't compromise on the lab procedures at all. So a cost of an IVF can start from 75,000 and go up to 300,000, 3 lakhs of rupees, also depending on what methodology we are using. But believe me, even with a low cost, we never compromise on the quality of the IVF cycle. The vitrification, again the vitrification, that is the freezing media, when we have to transfer the thawing media. So all this add on to it, but we have devised protocols, we have devised cost packages or for 1 cycle, for 3 cycle, and the procedures that we used starting from as low as 75 to 300,000. This is a couple who says that they have been married for 3 years. They are taking Ayurvedic medicine since last 2 years, still not conceived. Can you tell why? Well, we as human beings would always want to opt for a procedure which is less challenging, which is easier way out. And we depend a lot on the hearsay. And in India still there is lot of family pressure also. Somebody has conceived with this type of treatment, you will also conceive, and you keep going there for 2 years. Maybe that treatment was good for that couple, but it's no good for you because your problem is something different. As I told you, that younger patients, when we call you infertile is 1 year of married life with 3 times a week intercourse without any contraception, you have conceived. If not, you need to go to find out the cause. So 2 years trying, I think, is a long time. Ayurvedic medicine is very good, helps the male factor, can also help the female, but when you are not getting result with it, definitely it's a time to go and visit a gynecologist. Find out what is the cause. Are you ovulating normally? Are your basic ultrasound scan, the first scan we do, is the ovary normal, uterus normal? Sometimes you find that there are 2 uterus, or you find that only half a uterus is there, or you see that the ovary is very small with no good quality eggs. The male sperm analysis, check the tubes, at least these 4 tests, and see your hormones, the thyroid hormone, the prolactin hormone, the FSH on D3, these are important hormones. So basic investigations that need to be done is this, and after that decide the right line of treatment. So I would say that if you are not conceiving, find out about your eggs and the ovaries, find out about the tubes, find out about the husband's sperm parameters, and get a basic scan done to rule out that there is no abnormality in the uterus. Even the history tells a lot. So if you want, you can do a personal call. One of my doctors will take your history and counsel you further. If surrogacy mother is ours, another question, nice one. What will be the surrogacy cost? If the surrogate mother is yours, it's very good. You have to have a nice contract base that she is doing whatever willingly, and the cost is then only for the IVF cycle, creating the embryos and transferring the embryo in her uterus, which would be around 1.25 to 1.5. On an average, an IVF cycle, a very good IVF cycle will cost about 1.5 lakhs of rupees, including the embryo freezing. Do you call patient before starting any procedure of IVF? I would definitely want to meet or talk to the patient, because I get patients from all over the world for the IVF cycle. So say a patient from Canada and Australia cannot come and meet me before they start the IVF. So video conferencing. We just do an email exchange, then we call the patient and take a very detailed history as if she is sitting in front of me and asking everything. And then based on the history, we find out that what will be the ideal IVF procedure for them. And then we prescribe them 2 months of multivitamins, for the husband mainly zinc containing, for the female folic acid, because the egg that is going to come up for IVF egg retrieval is a 70 days procedure, and the sperm formation is on a 70 to 74 days. Because that is why what egg or sperm I am going to get today has been recruited 2 months before. So 2 months prior to IVF, very important. I had a couple from Middle East. They were setting up their IT business in Hong Kong. So they thought it's easier. In between, we'll jump in India, get our scans done, take injections and do the IVF. They were having late nights. They were only on junk food. And to our utter despair, we found that when we took out eggs, there were 14, but none reached blastocyst. And they were really upset that when we did our cycle in Dubai, we were getting 5 blastocysts. And what's wrong, doctor? We never got a blastocyst here. We understood their lifestyle, and they said it was horrible. 2 months of no sleeping. We were setting the business and we were eating whatever there. I said, that is the culprit. I advised them. That was in February. Then I called in May. I said, don't move out of Dubai. Just have a healthy lifestyle, exercise, vitamins, and then come to May. In May, they came over. We did the IVF, froze the embryos. In June, we did the transfer, and they are blessed with twins. We got 8 blastocysts. So your lifestyle 2 months prior to starting your IVF is very, very important. So this is my advice: multivitamins, exercise, healthy food, and healthy lifestyle, sleeping pattern, etc. And that is the reason I call. And if you are within India or within reachable, I would also want to do a scan. Otherwise, you can send your scan report from wherever you are, day 2. See that everything is okay. And definitely, if there is time, I would advise both the male and the female partner to follow this to get the best results in IVF. Is IVF a painful procedure? My answer would be yes and no both. One is that yes, there are females who are scared of injections and they would feel, but these injections are just beneath the skin, like insulin is being taken by diabetic patients morning, evening. So one time in a day these injections are taken because we need more eggs, and oral ovulogens are not working that well except for minimal stimulation. So these 10 days of injections is what. And then the retrieval procedure is not at all painful. We put our patients to sleep. Just like a scan, we remove all the eggs transvaginally, no cut, no stitches. The same evening she can go out and about and do her routine work. Embryo transfer, least painful. She's talking, she's looking at the screen on the ultrasound machine, and we are showing her that look, here the embryo goes and here we have put it and it comes out. No pain. Rest, yes, 3-4 days, but rest is not painful. Finally, it comes to the post-transfer medication, where there are people who prefer just the injections, there are people who prefer the vaginal tablets, and there are some who prefer oral. When we are doing in a natural cycle, the same cycle that we have removed the eggs and we are putting back the embryos, or in a frozen cycle when we allow the female to ovulate and then we are transferring the embryos, there is minimal support required. Oral ovulogens with vaginal tablets will suffice. So that is not painful. But if it's a frozen cycle or a donor egg cycle where the ovary is not functioning, then yes, some of the progesterone support is given with injections. It could be alternate day, it could be twice in a week. And these are oily injections which are painful and the female feels the pain. But now water-based solutions, injections are also available, so we supply that, and gels are also available which can substitute. So I would say that it's not a painful procedure, provided once you get a negative result, the female feels the pain. If she has the positive, that pain goes away and vanishes. So I would say that the attitude, the mental attitude towards this pain is more important than actually the pain that you get. So now it's become a very friendly IVF. We compartmentalize also. We do it in 2 phases. First we take out, freeze the embryos. That's only 10 days of that female goes around that IVF cycle. Then at her ease, after 2 months, 1 month, when she wants a transfer, she just starts tracking her natural cycle or takes the tablets and come back for a transfer, and then we transfer the embryo. So for her, that 1.5 month is not under medication, it's split into 2 parts. So we try to make it very friendly, but remember my friends, no gain without pain. So in IVF, that little pain that female has to undergo, but when you get that gain, you forget everything, like a normal delivery. It's so painful. It's so painful. Now you have epidural and everything. In our era, it wasn't there. But those 12 hours of pain did give us a lovely baby. So you forget all that pain. This is another question that what is luteal phase defect? Can you explain? Yes. This luteal phase defect is when the eggs get released and then the support to the corpus luteum, which starts releasing the progesterone to make the endometrial lining healthy and support embryo to grow. There are many females who will not have enough progesterone level naturally. So these are the females where there is a luteal phase defect. They will get a chemical pregnancy, urine pregnancy test positive, but then again after 2 days you see it's negative. So this is a progesterone deficiency which comes from the luteal phase defect, which comes from a defective corpus luteum, and they need treatment in the form of ovulation induction and then support of the luteal phase with progesterone. Can you give 100% guarantee of IVF procedure? I wish I could, but I'll never do that. I can give a guarantee that yes, the couples who try and keep trying, I've seen their results. They will always get a baby. But the guarantor is always the person up there in the sky whose blessings you need and as much and more we need it. But yes, go with a positive attitude. I have seen IVF cycle success in the first cycle for so many, and the highest maximum number of cycle in one patient that I have seen is 14, and in the 15th cycle they got a baby. So I can say that with a donor egg, I always say that 90% chances, if the male factor is good and the uterus is good, in 3 cycles we can guarantee. But 100% guarantee is, I think, a big no-no. If you hear that also, I feel, for me, it's not correct. Age of the female 32, another caller. Age of the male 37, duration of marriage 7 years. Reports of female normal, reports of male no motility. Should we go for IVF? Yes, 7 years, definitely. My worry is that I've seen patients who have low count and motility go lower and lower and lower in spite of all medications, and ultimately I've seen who have had a normal child before now has no sperms left at all. So don't delay. If your count were to improve, and I've seen a long-standing infertility is many a times or most of the times due to the poor quality of the sperm. Initially your count and motility is borderline, so you would be lured to go ahead doing naturally or just IUI. But this is the time, in 2 years, no result, go for IVF. So 100% IVF will be a good answer, and you will get a better success with IVF compared to any other form of treatment. Another question. I have high diabetes. Can IVF be advised in our case or not? High diabetes, if under well controlled, definitely you are having normal sugars, and you can go for IVF. I'll just give you an incident of my patient who was 49. She had lost her only daughter and she came for IVF. Naturally, we were using donor eggs. She was diabetic, she was hypertensive, she was obese, and she was hypothyroid. And we discouraged her. We said it's better we do surrogacy. She was affording. She said, no, I want to carry my dead daughter again. I want my own child. Believe me, did her IVF first time fail, second time she conceived twins. She remained admitted with us. And the amount of insulin she was taking, 40, 40, 40. With oral anti-diabetic like metformin. And she was on antihypertensive and she was on hypothyroid thyroxine drugs. She delivered 2 healthy, 1 girl, 1 boy, who are almost now 2.5 years old. So if you go with that attitude that I'm going to control my diabetes very well, I'll be ready for 3 shots or 4 shots of insulin. Sometimes insulin pumps also help a lot. You can definitely carry your child and you can have a healthy child. So high sugar level is not a big no. As I said, get your HbA1c within 7. We start the treatment and then we continue the anti-diabetic drugs as required, and you can control your diabetes, have a healthy child. Are IVF babies as healthy as normal? Yes, they are. And now there's a proof, 40 plus years now, and millions of babies have been born all over the world. Okay, so IVF babies, previously they were thought to have some diseases which are more than normal, but now the comparisons have come. They are healthy, their weight is normal, and they do not have any extra diseases which a normally conceived or naturally conceived baby does not have. So IVF babies are as healthy as normal. According to the reports, the sperm motility is very low. What do you advise for this? I would say that when the sperm motility is very low, get your andrologist. We have 2 at our center who will check the person. Hormone tests are being done, and to improve that quantity and quality and the motility, definitely coenzyme helps. If you have any addiction of tobacco, smoking, drinking, should be stopped immediately. Zinc supplements will definitely help. Go for a regular exercise, and yogasans definitely help the sperm count. And Indian study is there where they've shown that yogasana can improve the quality of the sperms and reduce your weight if you are obese. If you are driving a lot of motorcycle or near the heat or in a chemical environment, try to reduce that also. And with this, wait for 3 months with all these therapies, and if it improves, fine. If the motility still remains low, try IUI. If still remains low, then definitely IVF and ICSI would be the best answer. Chances of transplacental COVID-19 infection? Well, so far, I'll inform you that we have one more webinar talk next week where Dr. Yuvraj is going to talk on pregnancy and COVID, which is going to be very interesting for all the pregnant females around the world and who are planning a pregnancy. Vertical transmission is not there in COVID-19 infection, so chances of transplacental is not there. Padresh bhai no phone aata to. Once IVF is done, is it mandatory for the couple to visit every month, or we can have our checkup at our own city? Yes, this is a very good and very good question. I would say that it's not necessary that you go to the IVF center for your checkup. We allow all our patients from all the part of the world to go back to their country or city or town to go for their further follow-up. But yes, for the first 3 months, once they conceive, we would want to have the feedback to see that, especially when a donor egg was used, that everything is progressing. And we also, when they go, we share our protocol of the 9 month of pregnancy, and they show it to their doctor over there. And we always be in touch with their gynec also, their obstetrician, so that we know what's happening. but there is no need to visit us every month. There is no need to come to us for delivery. You can go back to your city, your country, or town, and we will be willingly looking at all your reports, what you send over the email, and we will also communicate with your obstetrician to have the best outcome. I have heard that IVF, one more question, yeah. I have heard that in IVF treatment, 99% it is twins. Is that true? Can I get singleton? Good question again. There are so many myths that IVF means twins. It's not so. On an average, if you see, now the world has moved over transferring a single embryo or single blastocyst transfer, because twins are a big no-no all over the world. But in India, we still have that craving, because when we put 2 blastocysts, the chances of success increases by 5 to 10%. So the Indian patients would want the success in the first cycle, and they are not even averse to an idea of getting twins. They feel that, okay, we have waited for 10 long years, we want twins, we'll sacrifice 5 years of our life with those twins. And the family support is also big. So they want to have twins. That's why we put 2 blastocysts. But on an average, when we put 1 blastocyst, only a day 5 embryo, the success rate is good, 50%, and the twinning pregnancy chances is just 1%. 99% it will not be twins, only if the blastocyst divides on its own. If we put 2 blastocysts, your success rate 5 to 10% increases. But in this scenario, we always say that if you get a positive result, 35% chance only of twins. It's not that always this both blastocysts will implant. So 99% twins is totally wrong. It's a myth. 1 embryo, 99%, 1 blastocyst, 99% single, and if 2 blastocyst transfer done, only 35% chance of twins. So, dear friends, I think we had a lot of good interactive session today. Akanksha Hospital and Research Institute, Anand, Gujarat, India is here to serve all our patients. We have our IVF department for more than almost nearly 3 decades now, and with about 18,000 IVF babies all over the world and about 1,500 plus surrogate babies all over the world. We have our own egg donation program, sperm donation program, and we have the highest advanced technology of time-lapse imaging, pre-implantation genetic screening in-house. We have just 1 or 2 clinics in India has it, and we can give the report turnaround time in 16 hours. And the platform is also next generation sequencing. We do a lot of advanced technology in the form of endometrial rejuvenation by endometrial PRP, hysteroscopic. We do ovarian rejuvenation with bone marrow concentrate, PRP. We do ovarian rejuvenation laparoscopically with ovarian tissue activation. And the latest that we have done is the thin endometrium. When it's very thin, destroyed due to tuberculosis or repeated DNC or myomectomy, we derive the bone marrow concentrate, and the CD133 plus cells are put inside in a cath lab from the femoral artery into the internal iliac and the uterine artery spiral arterioles. And we have done so far 6 patients. 3 have undergone embryo transfer, out of which has delivered already a healthy baby. Their menstrual flow increases, their endometrial thickness increases, and most importantly, the endometrium becomes very pink and the blood flow to the endometrium, the spiral arterioles increases. So with this, I would say that we are here to serve you forever. Do not hesitate to contact us at our email ID nayana@ivf-surrogate.com and the phone numbers which will be flashing. Tomorrow we have another interesting session by our interventional cardiologist Dr. Rohan Parikh, who is young, dynamic, knowledgeable and a very ethical cardiologist interventional. He will be talking to you about your heart. So know more about your heart. Keep your heart safe. Thank you. Stay home. Stay safe. God bless us all.